To the extent that medicine's developed a tough culture, it's probably because doctors care really deeply about their patients and they really want to try and do the best that they can for them. And that consequently demands a level of perfectionism, a dedication, which can be very draining on the individual. And as much as altruism could be considered a healthy defence, too much of it at the expense of the practitioner is where people can end up having some trouble. One of the big problems in medicine is that doctors would like to think of themselves as infallible and certainly not as patients, but the reality is that doctors are humans too, and sometimes they do suffer from mental health problems. And what's important to remember is that that's not a character flaw of a person, that's something that is intrinsic to the human condition, and you can find support and help. There's a bunch of things that doctors can do to keep themselves healthy. That starts with having a relationship with a GP and ensuring that you see them a few times during the year so that you're comfortable talking to them during a tough period. It includes also getting into healthy exercise and eating habits, making sure that you've got things to look forward to, like a holiday, even if it's several months down the track, and maintaining support networks socially with family and friends. And then finally, learning about mindfulness-based meditation and cognitive behavioural therapies, things that can be really helpful to you both in good times and when times are tough. Medical practice can be tough at times, but it can also be ultimately very rewarding, and looking after yourself and your peers is really important to help make the most of what is hopefully going to be a really long and happy career.